So immediately after birth, we want to encourage skin to skin right away, but we want to make sure that there's not family members interrupting that first hour after delivery. You want to make sure that she's just bonding within that process. The goal is to help her deliver the placenta within the first hour. Every client is different. Some clients it'll come out naturally on its own. But if she starts having contractions, so you can say, "Are you feeling any contractions yet?" And if she says yes, you can let her know you can breathe down on those contractions, or you can slightly push on those contractions to guide the placenta out. She may experience contractions and vaginal bleeding. That's completely normal. You will be able to tell kind of if she's starting to have contractions, because as soon as baby's born, she's going to be super happy. All the attention is going to be focused on baby. And then you might see her make faces like, she might start to look a little bit more uncomfortable. And then you can say, "Are you starting to feel a little bit of contractions?" And then she'll say yes. And then you can guide her on breathing baby down or pushing along with those contractions. She might also feel shaky or have chills. This is normal in all birthing environments, home, hospital, unassisted, VBAC, due to the hormonal changes, because the baby's not in there anymore. So there's a drop in different hormones and the body's like going back to normal and preparing for postpartum. If this is the case and you're virtual, you can just like tell her partner, what's the temperature like in the room? Are the windows closed? Are they open? Is there a fan on? If there's a fan on, you guys can turn the fan off. And if she's in the tub, then you can change around the towels, because usually the wet towels will make her feel a little bit cold. And if she's starting to get a little bit of shivers, then we want to transfer her from the tub, and whoever is there in person, like her partner, or maybe she has other support family members there, they can help her get out of the tub nice and slowly, sit on the bed, and then wrap her up in a few warm blankets, make sure baby doesn't have any wet towels on baby anymore, so that everybody can stay nice and dry and they're less likely to have those chills and shivers. Breast engorgement, some clients might get breast engorgement right away. It really just depends. Like every mom is different. And some women, their milk might not come in for another 2 days. If she is feeling some breast engorgement, which can happen, like as soon as baby comes out, sometimes the body just instantly knows baby's there and starts to fill up. We just want to encourage her to breastfeed on demand, or at least every 2 to 3 hours. If she's saying she's having like engorgement, or she's feeling like tender, her breasts are feeling really like tender, you can encourage her to take a warm shower, because it helps to soften the breast tissues, and like the milk will actually leak out in the shower. It'll just start dripping down on the floor. And I think that this is the best way to express the milk versus pumping, because when you pump the breast milk, the body believes that the baby is drinking that milk because of that suction. The body can't really tell the difference between a pump and the baby sucking it. And what the body does is, if you're telling the body that baby's feeding right now, the next day it's going to produce milk at the same time of the time that you pumped, because it's like baby was hungry then, so that's the pattern. We're going to produce milk so baby can eat again at this time. And so it kind of becomes like a circle of like, breasts are getting filled, and then you pump, 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 and then it comes back, and then it comes back. So the best way is really to naturally allow it to just get used to baby's feeding patterns. And the shower definitely helps, because it naturally kind of just expels on its own. If she has any trouble urinating, or maybe she wants to hold back from urinating, running water over her vagina will help with urinating. Also, if she needs to, she can pee in the shower. Sounds funny, but yeah. She can also pee in the shower because the water running will help her as well. And her bowel movements will usually go back to normal 2 to 3 days after birth. She will just fill it up. You can have your client get a peri bottle prior to her birth, and this can be like something she can have in like her home birth checklist, or for her postpartum. Golden hour is basically, it's the first hour, yes, the first hour after birth when a mom has uninterrupted skin to skin contact with her baby. During this time, encourage your clients to bond with baby and family. If she gets contractions, she can breathe or push on the contractions to expel the placenta. And if she delivers within the first hours, you can tell her to place the placenta in a strainer in a bowl. And this is what a normal water birth would look like. You would still see little bits of water in there, a little bit of blood, that's completely normal. But if it looks like this, and she wasn't like moving around and mixing around the fluid and the blood and the water, then you would want her to tell her partner to call EMS, and contact their care provider. So anything like this and like this is normal. 60 milliliters is normal. This is normal. This is normal. But this is not a blood clot. This is just a cotton swab or something cleaning it up. So that's normal as well. But this is not normal, like heavy, like blood, like on the ground like that, like a pool of blood. That's not normal. Anything like this is not normal. This is not normal. And this is kind of what 500 milliliters looks like. So you just want to keep that in mind as well.